Hello, my name is April Baller. I work in the WHO Health Emergency Unit, and I'm the focal person for infection prevention control. So today we're going to go through a module which is specifically looking at infection prevention control and clinical care. Although sustained human-to-human novel coronavirus transmission within the general community has to date not been confirmed, limited transmission within households has. To avoid transmission, the general community needs to avoid agglomerations and frequency of closed, crowded spaces. They also need to maintain a distance of at least 1 meter from any individual who has novel coronavirus respiratory symptoms such as coughing or sneezing. Perform hand hygiene frequently using alcohol-based hand rub if hands are not visibly soiled for 20 to 30 seconds, or soap and water when hands are visibly soiled for 40 to 60 seconds. And also refrain from touching mouth or nose. Individuals with respiratory symptoms should wear a medical mask and seek medical care if experiencing fever, cough, and difficulty breathing as soon as possible or in accordance to local protocols. Healthcare workers may be at risk of infection. Early respiratory infection symptoms can be nonspecific. Thus, healthcare workers may not be prompted to implement additional precautions to prevent transmission while providing care. Hence, the importance of standard precautions. Use standard precautions for all patients in all settings at all times, regardless of symptoms. Standard precautions include hand hygiene, respiratory hygiene and cough ethic, use of personal protective PPE based on risk assessments, and also apply safe injection practices. Standard precautions include environmental cleaning, waste management, linen management, and care of patient equipment. At triage, early recognition of patients with novel coronavirus is very important. Have a high level of clinical suspicion of novel coronavirus. Give the patient with suspected novel coronavirus a medical mask. Place the patient in a separate area, as this will contribute to source control and diminish potential for environmental contamination. At triage, also ensure that you have a well-equipped triage station. Institute screening questionnaires according to novel coronavirus case definition. Organize the space and processes to permit spatial separation of 1 to 2 meters between each patient with novel coronavirus and other individuals. Ensure that there are post signs in public areas reminding symptomatic patients to alert healthcare workers. And finally, ensure that triage and waiting areas are adequately ventilated. Encourage respiratory hygiene. In other words, cover the mouth and nose during coughing or sneezing with a tissue or flexed elbow, followed by immediate disposal of the tissue, and perform hand hygiene. When admitting patients to wards, ensure that only those with